Hello everyone and welcome to the Dental Implant podcast brought to you by Dr. Teeth, your most trusted dental clinic located in Kadapa, Andhra Pradesh. I am Dr. Mohammad Rafi and joining me is Dr. Sajid, the most experienced surgeon in Dr. Teeth. Together, we are here to guide you through the fascinating world of dental implants. Whether if you are considering this transformative procedure or just want to know more, you are in for an informative discussion. Okay, Dr. Sajid, just give a brief intro about yourself to our audience.
Hello everyone, myself Dr. Sajid. I'm MDS in oral and maxillofacial surgery. I have done my BDS in RIMS Kadapa and done my MDS from GDC Trivandrum. I have been practicing implantology from past 5 years and I have done thousands of implants and transformed hundreds of smiles.
That's great, Dr. Sajid. Let's start from the basics. What exactly is a dental implant?
Dental implant is a permanent fixed solution to replace any missing teeth. Whenever there is a missing teeth, it is replaced by multiple options, but the dental implant is the only option available currently in the market where we can replace the tooth exactly with resembling the tooth, and it's a permanent as well as a fixed solution. In the dental implants, what we do is there will be a titanium alloy metal which is placed within the bone doing a small surgery under the local anesthesia. It will give a proper strong support for the tooth to build up on that implant.
That's fascinating. So, who would you say is a good candidate for dental implants?
I would say all the patients who have a very good medical condition are definitely patients for the dental implants. They as such there are no contraindications for dental implants. We can do dental implant in all the patients, but the success rate depends on multiple factors and it differs from patient to patient. So a patient with a good medical history and medical condition without any comorbidities and very good amount of bone quality as well as very good oral hygiene. When these three conditions fulfill, the longevity also increases and the predictability of dental implants increase.
So, how long does the entire process take place right from the start to finish?
Okay, previously, like 5 to 6 years back, it was like it used to take like 3 to 6 months for the entire procedures to be done. But now we have the latest advanced technology in our Dr. T Dental Hospital, where we can finish the complete dental implant procedure within one single day. From the placement of implant to delivery of the crown, within one single day we can do. But again, there are multiple factors which dictates the amount of time taken for the complete procedure. Some patients might have very less bone, some patient might have other medical conditions where it will take some time. So we can't generalize everything for all the patients. It will be customized thing. So most of the treatments will happen within a single day. If at all there are some conditions, we will discuss them on our one-to-one consultation. Then we will let them know the exact timing. Hardly it will take 3 months as the maximum time limit.
Okay, are dental implants painful?
Obviously, no. Dental implants, in that case, any other dental treatments are actually not painful. Dental implants are done completely under local anesthesia, where a small injection is given to numb the area where the dental implant is going to be placed. Once the numbing injection is given, there will be no pain at all. And the placement of implant hardly will take 10 to 15 minutes. And there will be no flap elevation with the latest technology which we are doing. There will be no blood even. There will be no discomfort as such compared to any other surgical procedure. So I will say it is complete painless or at least minimal discomfort might happen that can be managed with over the counter medications.
Now let's talk about the longevity. How long does the dental implant last?
Okay, it is most commonly asked by the patients also how much time the implants will last in my mouth. Definitely, we can maintain the dental implants too long for the lifetime, but it can happen only from the patient side. It is like maintaining good oral hygiene, regular dental visits and checkups, and regular maintenance of dental implants. All these things actually increase the longevity. If these things are actually followed by the patient, definitely the implants will long for the lifetime. But if at all these conditions are not followed, if at all the maintenance is not happened by the patients properly, then there is no such thing like lifelong longevity, but still we can manage to maintain it for a longer period of time.
Risk or complication associated with dental implants?
Yes, there are few risks which are associated with dental implants, like infection. The most common thing is infection. Second most common thing is implant failure. And the third is the damage to the tooth or surrounding vital structures like nerve and blood vessel, which can happen in unexperienced hands. But these complication rates will be very minimal once the implants done by experienced implantologist or experienced surgeon.
Okay, now let's talk about the cost. How much do dental implants typically cost?
Okay, coming to the cost factor, it varies from patient to patient and it depends on multiple factors. Okay. The most common factor is the number of implants which we use in the patient. Then coming to the complexity of the surgery which again depends on the quality of bone the patient is having. And the various brands of implants which we are going to use, and the processes and the various types of processes which we are going to use. All these factors come into the actual final cost. But on our one-to-one consultation, we will provide the customized solution and customized estimation of financial estimation for the complete implant procedure. And along with that, we have no cost EMI options also, which makes the payment options very flexible and economical to the patients.
Any alternatives to implants, and why are implants preferable over all the other alternatives?
Yes, there are a lot of alternatives to replace any missing teeth in that case. For example, any missing teeth can be replaced either by a removable appliance or a fixed appliance. In removable appliance also, if there are a few missing teeth, we will go for removable partial denture. If there is multiple missing teeth, then we will go for complete denture. Okay. Whereas coming to fixed type of thing, there is something called fixed partial denture, where we take support from other natural and normal crowns, where the crowns are cut and trimmed into very little bit of trimming will be done. Then take support from those crowns. So these are the current alternatives available in the market for replacement of missing teeth. So obviously the question comes, why dental implants are far more superior, or why dental implants is always preferred compared to other alternatives which are available in market. The reason is, whenever there is a missing tooth, we have to replace the missing tooth with the material which almost resembles to the missing teeth. So in the market, the current available alternative to replace missing teeth and which is having high resemblance to the missing teeth is dental implant, where we have a normal root structure again a normal crown structure. So almost the force distribution is the same as that of normal natural teeth. That is the first thing. Second thing, whenever a patient is having multiple missing teeth, it will become very difficult for you placing the fixed partial denture, as we don't have that much support, and a lot of times the fixed partial denture will be having a cantilever thing, and which doesn't have the proper force distribution, and finally it again leads to damage to the normal natural teeth where we are going to take the support. And these are the multiple reasons why we prefer dental implants.
Are there any patients who are not fit for dental implants?
No, as such, there are no contraindications or no category of patients are there where dental implants can't be done. But I can say there are a set of patients where we have to do dental implants a little bit carefully. For example, a patient who is a very chronic smoker who smokes like 20 cigarettes per day, or a patient is having uncontrolled diabetes more than 250 mg per dl RBS levels, and uncontrolled hypertension, or having any cardiac diseases where he is taking any antiplatelets or anticoagulants. All these patients are the candidates who are at risk. So we can perform dental implants even on these patients with a very high success rate, but with little bit of caution and little bit of discussion with the medical provider who is treating these patients. Once the condition is under control, all these patients also can be treated with dental implants.
Is there any age limit for getting the implants?
As per the age is concerned, there is no upper limit for the dental implants to be done. Any patient at any age can be done can be rehabilitated with the dental implants. But coming to the lower age limit, at least the patient should have 16 years completed so that we can go for dental implants.
And finally, how should the patients care for the dental implants?
Coming to the maintenance of dental implants, there are only 3 things which you should take care of. Number 1 is proper brushing technique and using the proper brush and toothpaste to clean the dental implants and the tooth which we are giving. Number 1. Number 2 is flossing properly using the electric flosser in order to remove any food debris which is getting impacted because of the sticky foods which we are using in our day-to-day life. And the most common and most unused maintenance tip is visiting the dentist or visiting the implantologist once in at least 3 months can prevent any problem coming with the dental implants. So following these 3 tips can make the dental implants last longer. If you want to book an appointment with us and get a free one-to-one consultation on dental implants, then kindly click the link below and book the appointment with us. We are offering a free one-to-one consultation as well as multiple offers on dental implant treatment. So kindly don't hesitate to visit us at any point of time. Thank you.
Thank you, Dr. Sajid, for shedding light on the most commonly asked questions about dental implants. And thank you for our listeners to tuning in for the today's episodes on dental implants.